Terrific. So the bottom line is you were, very few people go into the staffing and recruiting business right out of school. But you were in the industries that you place people in. So you really have a deep understanding of those industries. And then you just transition into helping companies hire the people they need in those industries.
Yeah, I mean, it definitely helps to have, the understanding, because I do have 25 recruiters that work with me. And some of those are industry experts like myself, probably 5 or 6 of them. But the younger ones that that didn't grow up in the space, obviously you have to share that knowledge with them and help them understand just the technologies and the companies in the space. And so it certainly makes a big difference to have that knowledge. And probably more importantly too, is you can actually share that information with your clients.
Right, because you're in a niche and that's what makes you valuable. So tell me, what excites you the most about your organization?
Now, to me, probably the most gratifying thing is to be a valued partner, to be a resource for our clients. And it's so interesting in that after you've done this for 2 decades now, you look and you see what works and you see what doesn't work. You can see these startup companies, and that's mainly we work with small to medium-sized companies who are introducing a new technology. And the founders typically are brilliant people, obviously, because they've come up with a technology that's very unique and needed. But on the other hand, a lot of times they don't know how to commercialize a product or a test. And so the people that we really like to work with and enjoy work with, use us as a resource to help guide their business beyond just recruiting. And to me, that's adding value, and it makes you feel like you're a partner with them and you're guiding them along the right path, because we've seen what works and we've seen what doesn't work. And some people are receptive to letting us help them that way. Others are not, but you certainly offer that information to anybody who's willing to listen.
So you're talking about partnering with your clients to grow their business. What can you give me an example of what you would do typically that would really provide value to your clients that are trying to grow?
Yeah, I would say the main thing that we do with most of the partners, most of the companies we work with, a lot of them, they have the technology, but most of the time it's on the commercial side of the business and how to commercialize and generate revenue, which obviously is pretty important. And there's several companies that come to mind, but there was one probably 10 or 15 years ago that was just it was an 8-person operation, and I got to know the CEO of that company, and we talked usually every morning about 6:30, because he was just an incredibly driven person. And he asked me, he said, "Tony, can you call me early, because my staff comes in about 7:30 and I'd like to talk to you then." And so we helped that company build the whole company. Eventually that company was sold for $450 million to Becton Dickinson, which is a big player in the market. And that CEO and I are still friends. We talk all the time, because we were partners with them. We didn't just try to sell them people. I mean, like a lot of recruiters are, try to sell you people. And I tell all my recruiters here, I don't want to ever hear you do that. I mean, I want you to present the good and the bad about candidates, because there's no perfect, obviously, fit. And so that was probably more just from sheer resources and building that company up. I think they were probably a 200-person company by the time they were purchased by Becton Dickinson for $450 million. That's one example. Right now we're working with a company that the CEOs, Stanford grad, great product, but they're not getting reimbursed, through all the managed care organizations. So if you're in that space and you're not getting paid, what difference does it make? And so we've been talking to them about a reimbursement strategy. And so we connected them with a consultant who is, you know, well known in the space. And so now, you know, he's coming in and actually kind of cleaning up. They probably should have started with this first, you know, with knowing how they were going to get paid and how they're going to get reimbursed. It was a thought process of, hey, if we have a great test, you know, then it'll get used, it'll get ordered, and it just doesn't happen that way. It's a practical aspect of medical that somebody's got to pay for.
Right.